Colon cancer is a formidable enemy that silently lurks deep within our bodies, often unnoticed, until it is too late. This insidious disease is characterized by the uncontrolled growth of malignant cells in the colon or rectum that can attack anyone, regardless of age, gender, or race. In this video, we'll dive into the world of colon cancer, shedding light on 8 important symptoms that should never be ignored. These symptoms serve as the body's way of sending distress signals, urging us to take action and seek medical attention before it's too late. Colon cancer is a common and potentially life-threatening condition, according to the American Cancer Society. It is the 3rd most commonly diagnosed cancer in both men and women in the United States, and is responsible for a significant number of cancer-related deaths worldwide. There is hope in the fight against this formidable enemy. Early detection through recognition of symptoms can make a big difference in the prognosis and treatment of colon cancer. The key lies in vigilant awareness and prompt action. So let's embark on this journey together to explore in detail the 8 serious symptoms of colon cancer. By the end of this video, you will be fully equipped with knowledge that has the potential to save your life or the life of a loved one. Remember, the key to overcoming this illness is to never ignore the warning signs. 1. Blood in stool. When blood appears in your stool, it can be due to a variety of factors such as Fisher's anal hemorrhoids or gastrointestinal bleeding from other sources. Swollen blood vessels in the rectum or anus are tiny beds in the anal lining can also lead to blood in the stool. These conditions, although worrisome, are not usually associated with colon cancer. The important aspect is to differentiate between these causes and recognize when to seek medical attention. The type of blood in your stool may be valuable. Clues of bright red blood in the stool often suggest recent bleeding, rectum or anus, such as due to hemorrhoids or anus. Darker or blacker stools may indicate more bleeding in the digestive tract, possibly from the colon or stomach. It is important to note that blood in stools can sometimes appear as streaks or mixed in with feces, making it harder to see. 2. Stomach pain or discomfort. Understanding the nature of the pain and its location can provide valuable clues. Abdominal pain due to colon cancer is often described as intermittent or persistent cramping. It may be located in the lower abdomen and can sometimes be associated with bloating. It is important to note that abdominal pain is a nonspecific symptom, meaning it can occur in many conditions other than colon cancer. Gastrointestinal problems such as irritable bowel syndrome, diverticulitis, IBS, or gastritis can also lead to abdominal discomfort. In some cases, colon cancer-related abdominal pain may be accompanied by other symptoms, such as a sudden change in unexplained weight loss or blood in the stool, or any combination of these symptoms can be particularly worrying and require immediate medical attention. 3. Weight loss. Weight loss? It is essential to understand that significant weight loss without a clear explanation is not normal. In general, healthcare professionals consider weight loss of more than 5% of body weight over a period of 6 to 12 months to be unexplained. While there can be many different causes, unexplained weight loss reasons, it is important to consider the possibility of an underlying health problem, especially when combined with other symptoms. Colon cancer can lead to unexplained weight loss for a number of reasons. First, tumors can reduce nutrient absorption in the colon, leading to nutritional deficiencies. Additionally, the body's immune response to cancer can increase metabolism, causing a person to burn more calories than usual. 4. Fatigue. Fatigue related to colon cancer is often more than just a feeling of tiredness. It can be extreme exhaustion that interferes with your daily activities and quality of life. This fatigue can be accompanied by weakness and lack of energy. The link between colon cancer and fatigue lies in the possibility of developing anemia, a condition characterized by a reduced number of red blood cells or low levels of hemoglobin in the blood. Colon cancer when the tumor causes bleeding in the digestive tract, leading to iron deficiency and decreased red blood cells, resulting in a reduced ability of the blood to carry oxygen, which can lead to fatigue. 5. Anemia. Anemia is a condition in which your blood lacks healthy red blood cells to provide enough oxygen to your body's tissues. It can stem from a variety of causes, including nutritional deficiencies, chronic diseases, and bleeding disorders. One of the potential causes of anemia, especially in the context of colon cancer, is its occurrence. Gastrointestinal bleeding can lead to anemia when tumors cause bleeding in the digestive tract. This bleeding often goes unnoticed and can gradually lead to significant blood loss, leading to decreased red blood cells and reduced oxygen carrying capacity. The result is anemia. Symptoms of anemia can vary but often include fatigue, pale skin, shortness of breath, and cold hands and feet. It is essential to realize that, although anemia can be a symptom of colon cancer, it can also be caused by other health problems such as nutritional deficiencies or chronic diseases. 6. Rectal bleeding. Rectal bleeding specifically refers to the presence of blood coming out of the rectum or anus. It can be clearly seen on toilet paper after wiping or in the toilet bowl. The color of blood can range from bright red to dark red, depending on its origin and how long it stays in the digestive tract. Rectal bleeding can be associated with a variety of conditions, including anal fissures or gastrointestinal bleeding. Swelling of blood vessels in the rectum or anus is a common cause of rectal bleeding, especially when the blood is bright red. Similar to a small anal fissure, layers in the anal lining can lead to rectal bleeding. However, when persistent rectal bleeding is severe or associated with other related symptoms, it should be a warning sign. It could be a sign of an underlying problem, including colon cancer. Cancer can cause rectal bleeding. When the tumor bleeds into the colon or rectum, this bleeding can result in dark or black stools, because the blood has time to mix with the stool as it moves through the digestive tract. In such cases, rectal bleeding may be a late-stage symptom of colon cancer. 7. Constipation. Constipation is a common digestive problem that most people experience at some point in their lives. It is characterized by infrequent stool movements, difficulty passing stools, or dry, hard stools. In many cases, constipation is a temporary problem that can be resolved with medication. However, dietary and lifestyle adjustments should be made when constipation becomes chronic and is accompanied by other related symptoms. Chronic constipation is defined as having fewer than 3 bowel movements per week and experience these symptoms for a long time. Colon cancer can cause chronic constipation because the presence of a tumor in the colon can interfere with the normal flow of stool, so you may have difficulty defecating and reduce the frequency of stool movements. It is important to distinguish between occasional constipation and chronic constipation. Frequent constipation can be caused by stressful dietary choices or other temporary factors. 8. Diarrhea. While constipation can be a worrying symptom, diarrhea is equally important to consider, especially when diarrhea is persistent and unexplained. It is characterized by frequent loose and watery stools and can have a variety of causes, including infection, dietary choices, or health conditions latent. Colon cancer can lead to chronic diarrhea, when the tumor blocks the normal passage of stool through the colon. In such cases, the body may respond by increasing the frequency and looseness of stools, leading to diarrhea. It is important to realize that chronic diarrhea should not be ignored, as it can lead to dehydration and nutritional deficiencies. Chronic diarrhea can be debilitating and significantly affect your quality of life. Thank you for watching our video about serious symptoms of colon cancer. You should consider never ignoring your health is important, and being aware of these signs can make a real difference in early detection and treatment. However, please remember that this video is for informational purposes only and is not a substitute for professional medical advice. If you are someone you know who is experiencing any of these symptoms, please consult a healthcare provider for evaluation and diagnosis based on up-to-date information. Stay healthy and do not hesitate to seek medical attention. Help when needed. If you found this video helpful, please hit the like button. Subscribe to our channel for more valuable health information. And don't forget to hit the notification bell to never miss an update. Thank you for being part of our community, and we'll see you in the next video.